Hi, my name is Dr. Rankin. I'm a licensed chiropractor here in Burnsville, Minnesota. The name of my business is South Metro Wellness Clinic. I've been in practice for about 10 years now, and I'm sure some of you have noticed we've had some changes in our environment lately with people working from home. So what I'm going to do today is talk to you guys about a safe and affordable way to help alleviate some low back pain or some glute muscle pain, or perhaps do some leg stretches using the handy foam roller that I have here today. So I'm going to go ahead and put the foam roller on the floor and talk to you guys a little bit about how it is that you can use this at home if you are not attending chiropractic visits, or if you're not able to get massage for whatever reason. There are other affordable options you can use at home to try to stay on top of your health care. So here we go. We're going to put this guy right down here. If you're new to my channel, welcome. We do weekly visits here talking to you guys about health and wellness and how you can use chiropractic massage and other positive vibes to help improve the quality of your health. So I'm going to go ahead and start right down here. This foam roller comes in 3 different sizes. So I'm going to step on over and we're going to just show you how we start with some of these things. The most important thing that you can do is use your hands to brace yourself. The black foam roller is extremely hard. It is not the most user-friendly on your first go. So even when I get down here, this is actually kind of difficult, okay? There are going to be some grippers on the foam rollers that we use here. If you've ever attended LA Fitness or most regular fitness clubs, you've probably seen people use the foam roller and they roll themselves out just like a rolling pin. This is a treatment. It is actually a real thing, okay? So basically what I like to do is just brace myself here a little bit, and you can control how much of your weight you want to put down on the foam roller at any given time, and you just start to very slowly smooth over, okay? You're going to feel a lot of this, especially if you're brand new and you haven't done this before. Don't be alarmed if one side is more tender than the other side, okay? So we're going to roll over here. Many of our low back patients here at South Metro Wellness do struggle with pain in between visits, okay? And what happens is the glute muscles get weak, and most of our biokinetic issues that cause chiropractic concerns and spinal imbalances in the first place. Also, furthermore, the muscles behind your thighs and on the side are going to be very, very tight as well. So for today, we're just going to focus a little teeny bit here on rolling over. And for me, it's the right side. I sit on the right, so if you are working from home and you are seated and you favor one side, that one side is going to be a lot tougher than the other. I noticed in my massage treatment last week that the sides of the legs toward the knee were extremely, extremely tight. Okay, so that's the first portion right down there. And you want to gently roll over and get some stretches in. Okay, and I can feel it's different on one side to the left, from the right to the left. Okay, then furthermore, what you can do, move the foam roller. I'm just going to move the foam roller down. I'm going to lean toward one side, and then once again, make sure you're using your hands to brace your body weight, because you're going to be able to feel an awful lot. This is not just fun and games. It's definitely an exercise. It's definitely a stretch, and I'm not going to be able to stay down here on this side very long. Okay, make short little strokes. If you're advanced, you can really move over and do some much longer ones, okay, but that's after you're feeling up to it. This is not a day one exercise. Then Jerry, my videographer, giggling and laughing and shaking his head behind the scenes, because I would laugh at me if I were doing this as well. Okay, we're going to stop, reposition, meet you guys over here on the other side. This time, I'm going to lean with one hip down, really, really brace, and then focus on the opposite. Whatever stretch you do on one side, you're going to want to make sure you repeat on the other, okay? That's just symmetry. Okay. Whew. Yeah, that one's really tight. So whatever body area that you have that you want to work on, you can use the foam roller at home, and this is very simple. And once you start using this activity, you can start building up to it. And see, because this side is much more tender, I can't spend actually any more time just on that one side, okay? Another tutorial is using just the calves. Because I don't struggle with calves as much, I can actually do both of them together. But for anything from the knee to the hip, definitely is a one-sided deal for me. One side is more than enough at a time. Gastrocnemius, or calves, are really, really tight muscles for most people, both men and women. So you probably feel tons and tons of pressure right in there. So once again, as you can see, I'm basically bracing the majority of my weight just with my hands and my arms. I'm not letting too much of this fall because you have complete control of this. So you'll definitely have to practice. See how much of this you can do. Okay? Let's go ahead and meet back up here. And we'll stand right back up here. I do believe this is size number 3, so it's the biggest one. I want to say that I've seen foam rollers that are this size as well, and then probably more like here on this side. Because we have a busy practice here, we have a large size, one size fits all. So I basically let my patients take this, use it for a week, see if they like it, purchase it on Amazon, purchase it from, I don't know, Jay, where else could you buy these? I don't think I've seen them at Target. Not yet. Not yet type of this. This one came from Amazon, if you will. Okay, so that is it for today. Basic foam roller opportunity there, something you can do at home. These last forever. I've never had one break or anything like that, so we've never had an issue. I guess the only issue we would have here is, do the patients bring them back? Yes, they absolutely do. So that is it for the foam roller demo and tutorial. I hope you guys learned something very, very effective. Tune in next week and join us for our next tutorial. It's been Dr. Rankin. Nice chatting with you.